Uncle Trump has one shot, one opportunity to stop the death of America. One moment with the freedom of vengeance. But what DC with, y'all?
Vivek's palms are sweaty, his next big job gets heavy. There's curry on his sweater already, mom's tandoori. He's nervous, but DOD is getting all ready to drop bombs, cause he gon' got the fat with Vetty. He goes down, DC crowd cries so loud. He opens his mouth, the words if I just come out. They choking now, we the people joking now. The clock's run out, time's up, over, blast. Snap back, DOD, Elon, place with gravity. Oh, grab your bureaucracy, choke, he's so ready. No post, make it look easy. No, he works at it, he knows they push him into these ropes. It don't matter, he's dope.
We're here at the MAHA conference at the state capitol in Harrisburg, and your name is?
Jordan Scott Gilbert.
And why are you here today, Jordan?
I'm here to support RFK, President Trump. I think it's good to eat real food. If you're not eating real food, that's bad. If you're protesting against eating real food, you're probably eating fake food, and you should eat some real food, and it might change your mind.
What do you think of the food pyramid?
Oh, I love it. Flip it. It's amazing.
Isn't it incredible?
And it should have been that all along.
Yes, when they told you don't eat eggs or don't have whole milk.
yeah.
I mean, it's almost insane.
Well, there's a lot of special interests and money, involved, of course, with promoting different things, like any business. But unfortunately, food is extremely important because if you don't have healthy food, you're not going to have a healthy mind, and you're probably not, going to vote for Trump in that case.
Jordan, you seem to be pretty brilliant. What do you do for a living?
So I'm a Broadway producer, film director, and actor, singer. Been in entertainment most of my life, and I produce Christian and conservative content, high quality, not corny, really deep, artistic Christian content.
Well, God bless you. We'll look you up. What's your name?
Rebecca Gilbert.
And what are you here for today?
Well, I support everything Robert Kennedy is doing. I think it's great that he's bringing awareness to a lot of just the issues in health and in our food supply that really no one else has been willing to talk about. And I think that, the public needs to know, and we need to put an end to a lot of these practices.
That's wonderful. And what do you think about getting involved? Should people be getting involved? And how do they do that?
Yes, I definitely think people should get involved. I've run for office here in Pennsylvania before, and I'd like to run again. And I think, you can just start on a local level and, do whatever you can and try to make a difference in whatever areas, you're passionate about.
Well, that's good advice. You have to ask yourself, what are you doing to get involved in your local area? Thanks so much.
Yes.
Go MAHA.
Thank you so much. Go MAHA.
Ask you, what do you think about the food pyramid? Have you taken a look at that?
I haven't taken a true look at it, but I'm glad that he's pushing for a new, healthier, something that actually is genuinely good for us instead of the My Plate that Michelle Obama enacted. I'm glad that he's actually giving effort towards making our country healthier. So I imagine, like I said, I haven't taken a true good look at it, but I imagine it's pretty good just because he's hard driven for this healthy movement.
I mean, you see so many people go into Washington, they just talk. And you see RFK Jr. got in there. He's not giving all these big speeches. Of course, he's here today, but he's not giving all these big speeches. He's doing it, and he's getting it done. And I like how much his food pyramid lines up with diets that I've seen recommended. Lines up, and it's not bought out by bureaucrats and crap like that, bought out by food industry. I love it.
Well, that's great to hear. So let's do one for the team. Go MAHA!
Go MAHA!
Thank you.
You're welcome.
We're really honored to have on the MAGA Kingdom Report Representative Leadbeter, who is the chair of the Freedom Caucus. And how are you?
Good, Anastasia. Thank you so much for being here this morning. Very exciting, not only to see everyone on a non-session day, but the turnout for such an exciting event.
It is really incredible. Before we start, we do want to say thank you for all the work you've been doing to protect our young girls. I have 2 young daughters. And can you just say a couple of words about how that all went down?
Sure, absolutely, Anastasia. So the Dads Defending Daughters bill is a continuation of protecting women in their sports, ensuring that biological males cannot participate in those sports. We understand that biological males, they have bigger lungs, bigger bones, bigger muscles. We know girls have bigger brains, but at the end of the day, we want to make sure that biological males do not participate in women's sports, whether that be at the collegiate level or the high school level, anywhere in between.
So today we have a special guest coming today at the rotunda of the state capitol here in Pennsylvania. Tell us a little bit more.
Well, Anastasia, it's an exciting day. Obviously, I think everyone in your audience is certainly aware of the effort that Secretary Kennedy has done, ensuring that America's future is a healthy future. We have bills here in Pennsylvania, in Harrisburg, in the State House, the Healthy PA bill package, which I'm a co-prime on, that is reflective and parallel to those efforts that are happening at a federal level. Today, this morning, in a few minutes, Secretary Kennedy will be joining us here in the rotunda, just up on the stairs here behind us, and speaking a little bit about how those efforts have allowed Pennsylvania to make progress and how Pennsylvania will be able to help be part of that mission in making America's future a healthy one.
As we all know, Pennsylvania was a birthplace of liberty in this country. And wouldn't it be amazing to continue in that tradition of not only providing liberty to our young girls, but also in the decision-making of protecting the farmers and putting good, healthy food on our tables? That's amazing.
Absolutely. Anastasia, it's a great effort. It's not partisan. It's not controversial. Everyone should want our kids to be able to eat healthy. Everyone should want to be able to support farmers, because at the end of the day, that's how we keep ourselves going. We all eat, last time I checked, and it's important that we keep that as a focus so that we're as healthy as we can be.
So everybody listen, we got some good people here in Harrisburg. They need our support for common sense bills. What are you doing out there to lend your support? If you want, please text us or email us how to get involved and support these common sense bills to help all Pennsylvanians. Thank you so much for everything.
Thanks, Anastasia.
And what is your name?
My name is Nichelle Schoaf.
And your name?
Doug Swartz.
And why are you here today?
Here to bring light to profound autism. I have a son with 24 with profound autism.
And how has Bobby or RFK Jr., our health secretary, helped in this fight?
So far, with restrictions being lessened so that we're not pressured to do things that might medically hurt them further. But we need more. We need him to get deeper into the tentacles of what's going on. Because right now what's happening in the state of Pennsylvania is not what he wants. I know it's not what he would want. They are pushing to remove our kids from the homes. They're lowering services. They're throwing them into crisis. They are purposely doing this to get these kids removed from the homes and get them out of small group homes. They want them in bigger institutions. And it's very widespread through Pennsylvania.
These are beautiful children whose family live for them and have been injured in one way or another. Environmental factors, vaccine, the mercury, the thimerosal, all these things. And now with the evaluation and the inconvenient study out and the lowering of the mandates of vaccines, I'm sure that must bring some joy, at least, to the issue.
To the future generations, because right now we have the first big wave of the adults that are coming up, and our system is overrun already. We can't handle it. We don't have enough staff. We don't have enough of evaluators. We don't have enough doctors. We don't have enough placements. So we have to think more creatively of what we're going to do with all these kids coming up that are now adults that need care. And some of us parents have been physically disabled due to these kids having aggression with us. So, you know, there has to be better conversation about what are we going to do about all these kids becoming adults and how are we going to care for them. And we would love to keep them in the home. Most parents would love to just be supported in the home.
There is no greater job than the job of a parent who loves their child and will do anything and is up all night with their child and sees a light in them that maybe others don't see. Would that be correct?
That's absolutely correct. I see pure joy when I see him. I see one of God's angels. And I see it's my job to protect that innocent being. And these are the most vulnerable population, along with our PTSD veterans and along with, you know, the elderly. And this population needs to be lumped into that certain population that we recognize they are extremely vulnerable and they're so at risk. And so just by placing them, you put them at risk. Why not stay with people that love them?
Absolutely, guys. You heard it here. The struggle that you're not going to see typically in the news. You're not going to see our politicians talk about. It is an issue that needs to be addressed. And we're here at the state capitol to sound the alarm and work with legislators who want to work with the families, the good families of Pennsylvania. Let's have one big cheer. Go MAHA.
Go MAHA.
Thank you.
Thank you.
What is your name, sir?
Fletcher.
And what are you here today for?
I am the grassroots director of the Pennsylvania Chase, so I am here trying to find some folks to step up and chase some ballots this election season because we are definitely going to need it. Democrats are energized, and we need volunteers knocking on their neighbors' doors and getting as many mail-in ballots in as possible if we have any hope of, making gains and winning this election cycle.
Would you say because Trump is not on the ballot, but yet he is, because he won't be able to get a lot of things through if we lose our majority? Would you say that's correct?
That is definitely right. The fact that he's, it is a midterm election, and historically, the opposing party is going to be a lot more energized, and we do want to defend a lot of these key congressional seats, especially Scott Perry. We're in Scott Perry's district right now. So we're mobilizing volunteers this weekend, this coming Saturday in Cumberland County to chase some ballots for Congressman Perry and others in similar situations where they could lose their seats. Because you're right, we do not want to lose that majority in Congress. We want to keep these impeachments from happening, and we want to keep it so that President Trump can keep on his agenda.
So what brings you here to the MAHA? Are you excited to see Robert F. Kennedy Jr., our health secretary?
I am, yeah, and I was not too sure about him back in the early days, but I was really impressed. I think it's a great coalition. I think it brought in a lot of people from the center, and I think we need to kind of continue with that to win this time around. But I think he's honestly one of the more impressive figures in the administration right now. So,
well, you heard it straight from Fletcher, who's working with Chase. And ask yourself, what are you doing with this election? What are you doing locally to make sure that our way of life, and believe it or not, having healthy food at the dinner table. I mean, this is all common sense stuff.
Absolutely, it is.
And supporting the candidates that support our families. So we'll see you at 2026 and before that, and make sure that our candidates win.
Yes, absolutely. And please visit phchase.com and try to download the PHase app today. Thanks.
Thank you.
Yep.
Ellis Dukart.
And what are you here for?
I am here for the event. We're here to make sure that everybody is registered to vote. Everybody has a plan to vote this year. We have protesters outside. It's only like maybe 10 or 12 of them, but what they are campaigning on is trying to get RFK impeached. So we can't let up in 2026 because we need to make sure that we maintain and grow the majority in both the House and Senate so that we don't have to deal with the impeachment of President Trump and the different secretaries like Secretary Kennedy. So that's what we're here for today.
And, I'm actually, full disclosure, part of Early Vote Action. I support you guys immensely and the work that you've been doing. And I am voting I sent out my mail-in ballot because we have to fight the system. We may not like it, but we need to fight the system. And I'm a hardcore conservative. So that's coming from one hardcore conservative to another. But what do you think about our secretary and all the work he's been doing?
I mean, personally, I love it. I look at we have up there the food pyramid. How many people in America knew that that's what they were supposed to be, eating before, the government finally came around and Kennedy's fixed that with the Hep B vaccination at birth in the hospitals, all the different vaccinations for the children. I mean, this is literally what we voted for. I'm getting chills thinking about where we were a couple years ago, wear the mask, get the jab, all of those things. It's like, we have to keep winning.
We're getting ready to save the next generation of families. And with this administration, we're getting it done. Thank you for all your work.
Absolutely. Thank you.
We're here with David Gary, who's the founder and CEO of Silver Age Labs. Tell us a little bit more about your product.
Well, colloidal silver is very effective against bacteria and viruses and fungi, pretty much anything infectious. And it was in widespread use 100 years ago, before the antibiotic era. And antibiotics kind of replaced it. Now we know there's some issues with antibiotics. There's some issues with vaccines. So lots of times the old ways were better. We need to get back to these things. We don't know what the next bioweapon is going to be. Might not be a failed bioweapon. And it works on pets, works on any part of the body, using your eyes, you can use it in your ears, you can drink it, you can inhale it with a nebulizer. We make a high-powered silver gel for skin infections, eczema, psoriasis, works on pets. We have a pet line as well, plus colloidal gold, colloidal copper, mouthwashes, toothpastes. You can go to silveragelabs.com to see our products in the locations around Pennsylvania that carry our product.
Here today. I want to welcome everyone, including all of you, my colleagues in the House and Senate, especially Pennsylvania State Treasurer Stacey Garrity, for being here today. It is my distinct honor to welcome Robert F. Kennedy Jr., the Secretary of the United States Department of Health and Human Services, to Pennsylvania. And he's here to kick off the Eat Real Food Tour. So Secretary Kennedy's visit comes at a moment when real strides are being made to improve Americans' health, progress that is taking place right here in Pennsylvania through education, bipartisan collaboration, and a renewed focus on prevention, wellness, and eating real food. My name is David Rowe. I have the privilege of representing the 85th Legislative District right here in the Pennsylvania House of Representatives. My district is heavily agrarian, run by hard-working farming families that put food on the table for millions of Americans. And as an agricultural powerhouse, Pennsylvania is the perfect place to kick off the Eat Real Food Tour. Eating real food matters because Americans, including Pennsylvanians, are facing worse health outcomes now than ever before. In the 1970s and early 80s, obesity rates in the United States were around 15% for adults and around 5% for children. Today, however, obesity rates are closer to 40% for U.S. adults and about 20% for children and adolescents. Rates of type 2 diabetes diagnoses among U.S. youth have roughly doubled over the past 20 years, which is very concerning and pairs with the rise in obesity. Rates of non-alcoholic fatty liver disease increased by 50% over the last 30 years. Additionally, the U.S. has seen troubling increases in diet-related chronic illnesses over the years. Meanwhile, the cost of treating, managing these preventable chronic diseases in the U.S. is priced at $4 trillion annually and growing every year. We all know these costs are passed along, creating hardships and increased insurance rates for families all across the Commonwealth. Here in Pennsylvania, we in the legislature are focused on common sense, bipartisan solutions to make healthier food more accessible and healthcare more affordable so that every Pennsylvanian can live a healthier life. I want to take a minute to personally thank Secretary Kennedy because the last few years have taken me on a health journey of my own that I want to share with you all. My brother and I, we used to own a chain of gyms, and activity used to be part of my daily life. However, after a bad skiing accident left me unable to walk for almost a year, I fell out of my routine. I spent a lot of time inactive. I spent a lot of time eating things that were definitely not real food, highly processed without any real nutritional benefit. As a result, I put on about 50 pounds, and I had begun to accept that this was my new normal. I even went and bought all new suits because I had long outgrown my old ones. But in 2024, I had a wake-up call. My doctor told me that my rapid weight gain had put me at a high risk for pre-diabetes, and I needed to do something. So early last year, because of the inspiration of Secretary Kennedy, I went, as I like to say, full MAHA, because I started eating only real food. Whether it was meat, eggs, cheese, raw milk, honey, only real food made up over 90% of my diet. And in just 8 months, I lost the 50 pounds I had gained after my accident, and at my next yearly checkup, my doctor was impressed and told me, keep doing exactly what you're doing. So thank you, Secretary Kennedy, for being an inspiration and bringing common sense back to the American diet with the Eat Real Food Tour. Now, before we hear from Secretary Kennedy, we're honored to hear from several Pennsylvania leaders who have been deeply engaged in advancing healthier communities and responsible public policy. So at this time, it is my pleasure to introduce Senator Kristen Phillips-Hill, who has been a strong advocate for transparency, accountability, and policies that empower families to make informed decisions. Senator Phillips-Hill.
I'm Kristen Phillips Hill, and I have the great honor of representing Southern York County in the Senate of Pennsylvania, and I am so excited to see friends, neighbors, constituents right here in our capital, Rotunda. And I will tell you that Pennsylvania is so very fortunate to have a rich history as a national leader in agriculture. Agriculture that provides some of the very best food for our nation. And I look around my district and I think of Shaw Orchards, and they produce some of the very best berries. I think of Flinchbaugh's Orchard and their farm market, which has some of the best apples. Maple Lawn Farms that grows amazing peaches. Sky Blue Farms with their incredible steaks and fresh meats. And of course, our famous dairies, from Rudders to Perrydale, that produce the best milk. And speaking of milk, I need to give a huge shout out to our Senate Health and Human Services Committee Chair, Senator Michelle Brooks, for leading the fight to bring whole milk back into our schools again. Thank you for that big round of applause. She deserves it, because we are making school lunches great again.
In the Department of Human Services, there was a 2,100% increase in reimbursement for puberty blocker claims using the code for precocious puberty.
The Healthy PA bill package, several things immediately came to mind. First, as a father, I thought of my children and the role that food plays in their development every single day. The role that it plays in their ability to learn and their long-term health into the future. What our children eat matters. It fuels and shapes who they become, and why House Bill 1131 is so important to keep the food that they eat at school from harming their development. The other thing that came to mind was our agriculture community and the strong presence that it presents here in our Commonwealth. These men and women have fed our communities for generations, and they deserve to have those efforts acknowledged, and innovations around cover crops and farming practices to be supported by all of us here today. Our farmers work with care, integrity, and pride, and they deserve policies that protect consumers while respecting the people who produce our food. Finally, I think of the importance of passing House Bill 1134 as part of the Healthy PA bill package to ensure that harmful dyes, addictive additives, and unnecessary chemicals are not quietly introduced into the food supply that families across our Commonwealth consume every single day. While those priorities were clearly shared by my colleagues, it was especially meaningful to see that our work aligned with the national efforts underway at the U.S. Department of Health and Human Services under Secretary Kennedy's strong leadership. Thank you, Mr. Secretary. What once appeared dormant breaks through, and the gift of life is experienced. That is the work before us today. That is the work that is part of this bill package, and that is what Secretary Kennedy is a champion for all of us in Washington. We must keep at this task every single day. We must keep doing the work, even when the results are not immediately visible. And we must stay consistent despite the headwinds that may come, knowing that the process itself is what makes the outcome possible. We must keep working, we must keep turning. And in time, as we have already begun to see, thanks to Secretary Kennedy's strong leadership, we will hatch the future of America's health, and we will eat real food. Thank you, Mr. Chairman.
Thank you, Representative. And now the moment we've all been waiting for. It is my high honor to introduce the Secretary of the United States Department of Health and Human Services, Robert F. Kennedy, Jr.
For being here today. want to start by acknowledging the leaders from Pennsylvania who've shown real courage on our health system. Representative David Rowe, Senator Judy Ward, Senator Kristen Phillips Hill, Senator Michelle Brooks, Representative Robert Leadbeter, Representative Natalie Mihalek, Representative Jesse Topper, and Representative Jake Banta. I'm grateful for your leadership and for the chance to be here in the State House as we launch our Take Back Your Health tour. We're here today because of the existential crisis in American health. Americans pay 2 to 3 times what Europeans pay for, our peer nations pay for healthcare, and yet we have the worst results in the worst outcomes in the developed world. We already suffer the highest chronic disease burden on earth, and our children are getting sicker by the day. This is not bad luck. This is genetic. This is not genetic. This is not inevitable. It's the result of decades of bad policy choices that have transformed America's once exemplary healthcare system into a sick care system driven by perverse incentives that reward every participant, doctors, hospitals, pharmaceutical companies, and insurers with more money for keeping us sick than they can make from getting us better or from preventing disease. The financial costs of this system are ruinous. Today, nearly 90% of healthcare spending goes to treating chronic disease, most of which are diet preventable or diet induced. More than 40% of every taxpayer dollar collected now goes to largely preventable diet-induced diseases. More than 70% of adults are overweight or obese, and 1/3 of teens have diabetes. When I was a kid and my uncle was president, juvenile diabetes was practically unknown. A typical pediatrician would see a single case of juvenile diabetes over a 40 or 50-year career. Today, 38% of American teens are diabetic or pre-diabetic. 1 out of every 3 children who walks through his office door is diabetic or pre-diabetic. And this is also a national security issue. 77% of American youth cannot qualify for military service, and that should get all of our attention. The administration believes that we need to start focusing on health long before someone enters a hospital. This transformation begins with honesty, with gold standard science, with transparency. And it begins with the courage to challenge all of the entrenched interests and systems and orthodoxies that profit from disease and from keeping us ill. President Trump is alarmed that we're hollowing out the American middle class and America's global leadership with both the disastrous costs of our healthcare system and its cataclysmic outcomes. Pharmaceutical and insurance companies are raking in profits while American families struggle to pay medical bills and children face demoralizing and expensive futures, struggling with crippling chronic diseases. A healthy child has 1,000 dreams. A sick child only has one. A majority of American children today are focused on just having a single day without pain, without suffering, without wrestling and struggling with chronic disease. President Trump wants to end the chronic disease epidemic and restore the American dream to the next generation of kids. In this cause, he is dismantling the old system and erecting a new one built on common sense, technological efficiency, prevention, and affordability. One of the things he's done is through the Most Favored Nation program to dramatically lower prescription drug prices in this country until for For 30 years in this country, we've been paying the highest drug costs in the world. We developed the drugs here. 70% of pharmaceutical profits come from our country. We only have 4.2% of the world's population. Why is that? We make the drugs, we pay for the innovation, and the European nations just say we're not going to pay for the drug unless you lower the cost. So at the beginning of this year when I came into office, the cost of Ozempic was about $1,300 listed in this country, and it was $88 in London. And oftentimes we're paying 2, 3, 4, 5, 10 times what the Europeans pay. Every president in my lifetime has said that they're going to fix this problem. Nobody has succeeded. They've all struggled with it, and they found that it was intractable. And yet now we have agreements from 16 of the 17 top drug companies to lower their costs so Americans will be paying the lowest cost of any country in the world. Because of President Trump's leadership, him calling me once a day for months on end saying, you got to get this done, calling Dr. Oz at midnight or 2 o'clock in the morning and saying, where are we? And then his adept use of tariffs. Because not only did we have to get the drug companies to lower their price, but we don't want to stop innovation. So we had to be able to make them make enough money, and the only way to do that was to get the European countries to raise their prices, which they did not want to do. But they've now agreed to do that because of President Trump's adept use of tariffs. President Trump RX reduces prescription drug prices for all Americans by giving patients direct access to lower priced medications, often tied to the prices that are paid. The lowest price paid in Europe is what we're going to pay here. We're also falsely forcing insurance to tell the truth about prices and coverage. And through the Great American Health Care Plan, we are returning power to patients. That plan puts money into the hands of Americans so that they can choose their own insurance. It requires insurers to post their rates and coverage in plain English, and it requires any provider or insurer taking Medicaid or Medicare to disclose prices clearly and publicly. When people know the prices and control their own dollars, the marketplace itself drives efficiencies, lower costs, and better health care. During the transition, Cheryl and I were staying with Dr. Oz, and one day we got a visitor, the former Prime Minister of Australia. After he served as Prime Minister, he was appointed to lead at the chair of commission to lower healthcare costs in Australia, which were astronomical, and to raise the quality of care. And he said the thing that he was immensely successful, and the one thing that made the greatest change was transparency. Was that people, before they received the treatment, would know what the price was, and that they were able to see their own health care records immediately on their cell phones so they could make good choices about their own health. And we've now accomplished both of those things so that we have agreements now with the 400 biggest tech companies to stop information blocking so that every American will be able to get their health care records on their cell phones. We're forcing insurance companies and hospitals to post their prices in advance. President Trump means to transform every American into the CEO of their own health. The United States leads the developed world in obesity, diabetes, fatty liver cancer, food allergies, autism, autoimmune disease, especially in children. When I was a boy, America had the healthiest children in the world. Today, we have the sickest. And that's why the Trump administration is changing course. Earlier this month, USDA Secretary Brooke Rollins and I released the dietary guidelines for food. These guidelines represent a dramatic break from the past. As you know, the dietary guidelines of the past were crafted not with the idea of public health in mind. You ought to eat dairy, you ought to eat eggs, you ought to eat meat. fruit and vegetable and high fiber grains. And these guidelines are going to drive the dramatic changes in dietary culture in this country. How are they going to do that? Well, it's going to change what the military eats. It's going to change what we feed.
Wow, we're here at the tail end of the MAHA event here in Harrisburg at our state capitol. And I'm just bumping into a friend of a great organization. Please tell the folks your name and your organization, what you guys do.
I am Stephanie Coxon with Pennsylvania Coalition for Informed Consent, and we are all about letting people have information and not allowing, but giving people information and making sure that they have the ability to make their own choices in medicine and in food, and that people just have the ability to get that information to make those choices.
Can you imagine that you actually have a choice to decide what you put in your body?
Right. Or to fire your doctor if you so wish. I mean, I think that people just need to be empowered to know what are their rights, and everyone should have access to all the information, not just one-sided information, so that they can ask questions. And so that's a big part of what we do, and just guaranteeing we follow bills, legislatively we follow bills to help guarantee those rights so that Americans can continue to be Americans like we were built for.
Do you think that it's one size fits all when it comes to the medical care for each citizen here in Pennsylvania?
Not at all. We are all designed differently. You know, one of my favorite books that I read was Eat Right for Your Blood Type. Thousands and thousands of people, thousands of people were followed according to their blood type and how they ate, and actually found that we are very different in what we need in terms of our nutrition. Why would it be any different for our medical care? What one person responds to with an antibiotic, the next person's not going to respond to. Medical care should not be standardized. We are not standard people. We are all different. We have different heritages, especially within the U.S., and so we shouldn't be treated as such.
And that's why it's a sacred relationship between you, your doctor, and leave government really out of it, except when they're providing options. And I think for today, one of the things that our health secretary was saying was really about choice, wouldn't you say?
Yeah, it was all about choice. They're not trying to take away anything, but they're trying to provide more choices and more affordability for people, and that's huge because that's what we need. I know there are people like it's just too expensive to eat organic, or it's too expensive to do this. So they are trying to find ways to make it accessible to people, whether you are on food stamps or a regular, middle-class family. But that accessibility is what they are trying to give the American people with the information, so that we can all do what is right for our families.
Well, you heard it, folks. We're here fighting for everyone's rights for education, to follow the science, good science, and make our own decisions and not look back and say coulda, woulda, shoulda.
So which science? So if you take a look, some of the editors have actually come out from the major journals basically saying, yes, some of the science is fraudulent. There's also been recent studies that have been submitted and gained awards that were completely made up, especially within the transgender stuff. Our science is not what people think it is. We are missing good science. If you go and look at the Chinese science, there are numbers that about 80% of their scientific articles are actually fraudulent. It's not that much different within the U.S. And so what we need is to bring back standards to question, because the number one goal of science is to question, and that means questioning until the very end. The science will never be settled. And if they say that it is, there's something wrong, that's a red flag, and that's when you need to stop listening and go do your own research.
So it's all about pro-accountability. No one's here to say you're anti-anything, but there needs to be accountability in the science, and you need to get involved, folks. How do people get involved to help with the fight for options?
So there are numerous organizations across the country that do what we do. So in Pennsylvania, Pennsylvania Coalition for Informed Consent, you can look us up and join our teams to help educate people, to show up on lobby days, to have conversations with people. There are a number of organizations in every single state that do the same thing. So find your organization within your state, find us within Pennsylvania or one of the organizations that works alongside us in order to start making a difference. Have those conversations. Your conversation with one person can make a difference. You can save one child by having a conversation with one mom, and that will generationally shift over and over again, and you can change the world. It doesn't take much, it just takes a little bit of action.
Well, thank you so much, and go MAHA.
Go MAHA, thank you.
Uncle Trump has one shot, one opportunity to stop the death of America. One moment with the freedom of vengeance, but with DC written young.